The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Welcome to Health for a Lifetime. I'm your host, Don McIntosh, and today we're going to talk about medications. They make a lot of promises, whether you're looking at them in the store or they're being prescribed by your physician. Are there pitfalls, though, along with these promises? Joining us today is Dr. David DeRose. He is a specialist in internal medicine, and he also has a specialty in preventive medicine. That's an interesting combination, doctor, and again, it kind of makes you maybe think you're going to talk out of both sides of your mouth concerning this issue. Are they positive? Are they negative?
I actually may, be honest with you, because, I mean, we're in a unique situation in this day and age, Don. We've got some medications that really have helped people, and yet at the same time, there are some real concerns with medications, and I'm afraid with all the positive press and the excitement about new drugs coming out, people are missing some of the real, very real pitfalls when it comes to medications.
Well, you say there's all kinds of new drugs coming out. I mean, every single day you see these big billboards, you see this on television, you see it in these newspapers and magazines. I mean, you just can't get away from it. Do you have a lot of patients that come to you and say, "Doctor, I saw this and I'd like it"?
You know, I think that's probably more common for the doctor who's in a primary care practice. At the Lifestyle Center of America, I'm in more of a referral practice. People come to me because they've run the gamut, really, of using all the things that seem to be available, and now they're looking for some new solutions. And they come to us really looking for lifestyle solutions. Often they've gotten disillusioned with medications or the way that their doctors have been using those drugs. They're not getting the results that the commercials talked about.
So what do you tell people at the Lifestyle Center of America about medications?
Well, my concern, Don, is threefold. When we talk about medications, and when we push medications as a society, three big dangers. The first one is we feed into what I believe is a misplaced focus. The second one is that there are real dangers to society because of overusage of medications. And then third, some real dangers to individuals who use these medications.
What do you mean by misplaced focus?
Let me give you a very tangible example.
Okay.
In 2000, the year 2000, the American Journal of Preventive Medicine, researchers looked at probably the two most prestigious medical journals in America, the New England Journal of Medicine and the Journal of the American Medical Association. What they did is they took all of the articles published in those two journals in the year 1998, they analyzed it, and finally in the year 2000 they published their findings. But what they found is that what was getting high-profile news, not just for physicians, but what's picked up by the media, is not things that look at prevention. Prevention only accounted for about 9% of all the articles in these prestigious journals. Only 2% of the articles, only 1 in 50, had anything to do with the basis of health, a healthy lifestyle. The vast majority were dealing with scientific research and drug therapies and epidemiology, looking at why things happen to people. All are important. Those things are important. Don't misunderstand me. But the point is our focus is misplaced. And I'll be honest with you, part of it is being driven by pharmaceutical manufacturers. In July of 2000, this issue, the Wall Street Journal, front page. Catch this headline. Drug firms stymied in the lab become marketing machines.
Oh, yikes.
I mean, just what you're talking about. Patients are saying, look, there's this new drug out. And the thing that's happening is that as pharmaceutical companies run into obstacles with coming out with new medications, they start to push that which they've already got. There's a need to keep selling those drugs. And so people in America, I think, many of them say, disease, problem, drug. I mean, it's like a knee-jerk response. You know, just like when I hit the patient's knee, you know, the leg kicks out. Well, it's the same thing. Problem? What comes to mind? Drug. And I'm saying that's a misplaced focus. We need to think lifestyle. We need to think prevention first. Not that drugs don't have a place, but they shouldn't be the first-line strategies when we're dealing with disease.
What can we do to avoid it to begin with, rather than having to say, what do we do now that we have it?
That's exactly the point.
Well, are there other problems besides this misplaced focus?
Well, the second area I talked about, Don, was problems when it comes to society. Societal problems in relationship to drug therapies. A lot of people say, what do you mean, problems for society when it comes to drugs? What does this have to do with you and me if we're not taking the pill? One of the greatest concerns today is antibiotic resistance.
Yeah.
More and more germs are becoming resistant to common antibiotics. This is a huge public health concern today. Let me just kind of walk you through and walk our viewers through this whole process, because a lot of people hear this antibiotic resistance, and we got to step back a little bit and get some perspective. I know you well know, Don, because of your training in nursing, that we all have normal flora, normal germ populations in our nose and in our mouth, in our intestine. These normal germ populations actually do some useful things. For example, the germs in our intestine produce vitamin K. The
clotting factors.
Clotting factors use vitamin K to work. And so the intestinal flora, the intestinal normal germs that live there are useful. They're essential for health. The problem is these essential germs are also susceptible to antibiotics.
So they get killed if you take them.
That's right. You take, for example, penicillin for strep throat. Now, I'll tell you, penicillin is a wonderful drug for strep throat. If you've got a strep throat, especially if you're a kid at high risk for rheumatic fever and kidney problems as a result of infection, I, as a physician, prescribe penicillin. I mean, it's a good drug when it's used appropriately. But here's the catch. If I give you penicillin willy-nilly, multiple times, anytime you walk in, you say, my throat's a little scratchy, I got a little congestion. What happens is each time you get that dosage of penicillin, whether it's for an appropriate condition or an inappropriate one,
kills all that flora.
Kills all the good flora as well. But it doesn't really kill all of the good flora. It kills the good flora that is sensitive to penicillin. But the flora that normally resides in your body that is not sensitive to penicillin survives and thrives. Why this is important is the germs that are in our body, as useful as normal flora may be, if our immune system becomes out of balance, if we have some type of injury to our bowel, to our nose, whatever, that normal flora can cause serious or life-threatening diseases.
And now it can't be treated because penicillin's already been there.
That's right. That's the issue of resistance. And so when we're prescribing more and more antibiotics as a society, this is posing real problems. Don, a lot of people say, oh yeah, big deal. I mean, I've taken antibiotics many times and it hasn't messed up my normal flora. Most people don't realize that in the world each year, some 1 to 2 million children under the age of 5 years of age die because of strep pneumoniae. This is a pneumonia caused by the common strep germ. Used to be universally, you could wipe out this germ with penicillin, but now more and more resistance is developing. And so deaths are occurring because of resistant organisms. It is not just, some politicians and health experts in the ivory tower who are worried about this. Antibiotic resistance is a big concern, and we really need to be concerned about it.
If you're eating animal products or, like, for instance, meats where those livestock have been treated with antibiotics, does this then affect you?
It is a concern, I'll tell you, because the animals that are being given antibiotics, what kind of germs are they going to have?
Resistant to...
That's right. They're going to have resistant germs. And so whether you are very careful with cooking your animal products, your meat, whether or not you had adequately pasteurized milk, whatever these issues are, especially meat, it's a classic one. You take meat and you prepare it in the kitchen, you handle the faucets in your kitchen, and then you can get cross-contamination. In other words, when you touch that knob again and then handle the lettuce that you're not cooking in the oven, you can get some of those same organisms and they can affect you. All this is extremely important, and it's not just a problem with our food choices, it's not just a problem with antibiotic prescribing. Let me just illustrate it this way. It has to do with our attitudes as healthcare consumers. A study was recently done looking at some 500 individuals. About half of them were the parents of sick children. The other half were adults with medical problems. And here's what happens. They walk into the doctor's office with viral infections. 30 to 50% of the time, what are the patients, if the adult is affected, or the parent on behalf of the child, what are they demanding?
They want a medication, but it doesn't, viruses don't need antibiotics, right?
That's right. Conventional antibiotics treat bacteria. And yet, consumers have in their minds, in certain situations, the researchers found this, if the infection is more severe in the perception of the parent or the individual,
they give them the drug.
Yeah, we need an antibiotic, doctor. And what kind of position is the doctor in when the patient says, I need an antibiotic?
He has to either take the time to educate and be a bad guy in their eyes, or he just gives it to them.
It's tough. It's very tough.
Now let me ask you this very practical point. Let's say I have a child today that's sick or somebody. How can I tell the difference as a layperson between having a bacterial infection and a viral infection?
You know what the best thing to do when it comes to diagnosis is see someone trained in diagnosis. That's the best thing.
So you see someone, and how do you tell when they see you whether or not it's viral or bacterial?
There are certain telltale signs, the company that the symptoms keep. For example, if someone has a sore throat alone, we look back there, things are bright red, there's pus back there, and that has all the hallmarks of a bacterial infection. Okay, so we're thinking strep throat or some type of bacterial infection. On the other hand, if it started out with kind of some sniffles and some earache, and there's no exudate, no whitish goop on the back of the throat, well, these are kind of signs that we're not dealing with a bacterial infection. We often are doubly careful in a situation like that, especially dealing with a younger patient who may be at high risk for rheumatic fever. We may do a throat culture or a rapid strep screen just to make sure.
Okay. So are there any concerns? We've talked about prescription drugs. We've talked about those that go to see their physician and antibiotics, basically. Are there non-prescription drugs that we need to be worried about, that we can overdo with, that can cause problems?
Well, you know, we talk about how society is affected by medications. And you're right, it's not just antibiotics that you need a prescription for. There's other drugs that really pose some risk to society. I mean, let me mention one class, and that is sleeping medications.
Okay.
If you go into the homes, now, of course, researchers actually don't go into people's homes and look in their medicine cabinets, but they interview people. And they find that the average American, as we get up in years, we start purchasing more sleeping aids, whether they're prescription or over-the-counter. And what happens is, Don, in our medicine cabinets in America, there are drugs that present a risk to our children. Kids can get in there, grandkids can get in there. They want to be like grandma and grandpa. They want to be like mom and dad. They want to take some pills. Or what happens if the kid's discouraged? They take some of mom or dad's pills, and it seems like a quick and easy way to get out of their problems. We don't think about these things, but we don't keep our medications usually in locked cabinets. And the child-proof caps, yeah, they may work for a 1 or 2-year-old, but what about a teenager?
So what do we do then to get past this problem that you've described so eloquently to us?
Really, Don, what we're trying to do in the program today is educate people. And one of the first steps in education is to move away from this mindset that you've got a problem, you've got to have a pill. And now, as we're talking about this, I mean, I can see some, gears grinding in people's minds, and they're saying, okay, no more medications. I got to be careful of medications, so I got to start taking, herbs and supplements. Well, I mean, that's not the solution either, because there are problems with herbs and supplements too. I mean, these are not the panaceas of today. The American consumer, who's getting concerned about drugs and some of these issues we're talking about, thinks that they can just willy-nilly walk into the health food store and walk away with a shopping cart full of supplements, and this is not innocuous either. Some of these supplements have toxic potential as well.
So give us some counsel on that. How do you know what to get and what not to get?
Basically, what I recommend people do is do research. Say, do research? I mean, how do we do research? You know, one is talk with your healthcare provider. A lot of people say, I don't want to see a doctor. I'm healthy. I don't need to see a doctor just for a virus. But if you're not reading widely in things that are not influenced by manufacturers, you are being led astray, really. Mm-hmm. What most consumers read are things that are heavily influenced by industry. Whether they walk into the health food store and pick up that nice, colorful, free magazine, well, who do you think put that free magazine there? Mm-hmm. I mean, it's someone trying to sell a bunch of supplements. Mm-hmm. If someone is talking with you about, touting the benefits of these great supplements, I mean, let me give you an example. Niacin. You take large amounts of niacin, and it can do some wonderful things for your blood fats.
Mm-hmm. But it can also make you just feel terrible.
Yeah.
And increase your... I mean, I think my dad used to take some of that, and he got all red.
But worse than that, it can cause liver irritation. It can worsen diabetic control. Mm-hmm. People, that's not what they read when they read the little promo in the health food store.
But they can go get it anytime they want.
They can get it anytime they want. And the perception is, well, it's a supplement, you see? Not prescription, over the counter, therefore it's safe. But it's still the same mindset. What I'm trying to tell people, Don, and what we tell people at the Lifestyle Center of America, is that we could decrease our problems dramatically if we get serious about lifestyle. Mm-hmm. Sure, it's harder to eat right than it is to take a pill. Mm-hmm. Sure, it's more trouble to exercise than it is to, pop a prescription drug. Mm-hmm. But these are really the things that pay the greatest dividends when it comes to reducing the burden of suffering when it comes to illness in our country.
We're talking with Dr. David DeRose from the Lifestyle Center of America, and he's got a burden about medication, and I hope that you have one too, and I hope that you have such a burden that you'll join us when we come back.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
We've been talking with Dr. David DeRose from the Lifestyle Center of America. He's got a burden that we're using far too much medication just willy-nilly. We're not really thinking it through. It's causing problems. We're developing antibiotic resistance and many other problems depending on the medication that we choose to take. We need to have more education. We need to be talking with our healthcare providers. Dr. DeRose, I have a question for you, however. You know, what is it that we take most every day? What is it that we put into our bodies most of the time? It's food. Is food a medication?
Well, I don't think most people would technically consider it a medication.
Depending on who's cooking, maybe, right?
Yeah, there you go. But clearly, food has profound effects. I mean, let's take the example of diabetes.
All right.
We deal a lot with diabetes at the Lifestyle Center of America. And when we're dealing with diabetes, people often come to us on medications that are doing one of several things. They're either taking shots, like insulin, that are raising the levels of insulin in their body. They're taking pills to stimulate their pancreas to produce more insulin, or they're taking drugs that help the tissues respond to insulin better. Now, regardless of what the patient is doing, most of those effects can be reproduced by lifestyle. Let me explain. Most people who come to our center, like most people with diabetes in our country today, have type 2 diabetes. Approximately 90% of people with diabetes have the adult onset form of the disease, and it's caused by insulin resistance. They don't need more insulin, but it's commonly treated by boosting the pancreas's output of insulin or giving insulin shots. That's not the optimal strategy.
Because it'll burn out the pancreas and doesn't solve the
Well,
problem.
the pills may be contributing to the demise of the pancreas, you're right. And higher insulin levels are being associated with diseases like heart disease and cancer. When you're raising insulin levels, you're tending to increase your weight. Now, let's bring this into perspective. How about the pills that lower insulin resistance? These would be drugs like glucophage, generic name is metformin, or Avandia, Actos. These drugs lower insulin resistance. Do they work? Yes, they work. But you know, there are ways without using drugs to lower insulin resistance.
Exercise.
Exercise, a beautiful one. But what about
high-fiber foods?
Diet, yeah. High-fiber foods, this is the interesting one. It's probably more the fat than the high fiber that lowers insulin resistance. The high fiber helps to regulate blood sugar, but it's not through lowering insulin resistance, except when you're eating more fiber, what do you tend to decrease? Tend to decrease the fat. When you're eating more fruits and grains and vegetables, yeah, you're more satisfied. When we decrease our fat, especially saturated fat, animal fat, what happens is insulin sensitivity increases. Insulin works better. And so we can often get people off medications, get them off their insulin. And think about it, Don. If you were in that situation, taking a shot every day or taking pills, wouldn't you rather change your diet?
Oh, most definitely. I mean, and so this is what you're saying. You're saying that instead of just taking a pill or asking a doctor for some kind of medication, we need to be addressing the underlying cause and things that we actually can do in the normal day-to-day activities.
Yeah, what I try to educate people to say is instead of going to your doctor feeling like because you just saw the commercial for the allergy pill and because you have allergies, you need to go and call your doctor or walk in and say, I need this new pill for allergies. Instead of saying that, you've got to ask yourself the question, what kind of lifestyle things can I do? You know what the thing about the lifestyle therapies are?
What is it?
They have side effects, but they generally are good side effects. You see? Exercise doesn't only help your diabetes, it helps to decrease your risk of heart disease and cancer.
Good side effects.
Yeah, it helps to improve your mental performance.
Okay, you convinced me, doctor. I'm going to go home. I'm going to take my medication. I'm not even going to empty it out. I'm going to pull the whole thing off the wall. I'm going to throw it out. Is that good advice?
Yeah, I almost just cut right in on you there, Don, because that's not the message I'm trying to give people.
Okay.
It is actually dangerous to abruptly stop certain medications. Classic example are the beta blockers, drugs that are used for heart disease prevention, for high blood pressure. Abruptly stopping beta blockers can actually trigger a heart attack. I don't advise people to just flush,
throw things away.
Yeah, don't flush the medicines down the toilet. That's not the solution. The solution is to say, look, maybe I've been moving in a mode of saying, doctor, what's the new drug? What drug can I take? Or maybe your doctor seems to be in that mode. And I'll tell you, it's usually not the doctor's fault. Because I've been in the position, Don, of patients walking out of my office, and you know what they're doing? They're complaining, especially new patients, not at the Lifestyle Center of America so much, but when I was in more of a conventional practice setting, people would walk out of my office and they'd complain to the nurse because I didn't give them a prescription. I gave them some lifestyle therapy. That wasn't why they came to see me.
They wanted a pill.
They wanted a pill. And so I try to tell people, yeah, you may be on these medications. Why don't you talk with your doctor? Why don't you read up? Why don't you get information as to how to decrease your medication? And when people are frustrated, they say, well, my doctor doesn't do that. I can't find somebody like that. There are lifestyle centers throughout this country that are specializing in lifestyle medicine. In Oklahoma, we're there at the Lifestyle Center of America, and that's what our focus is.
Have you seen a lot of patients come there that have been on, well, yeah, give me a scenario. Does someone come there 20, 30, 40 medications? What happens with them?
Oh, this is common, that people come on multiple medications, but most of them have gotten to the point where they've gotten frustrated. That's why they come to a lifestyle center. And they say, you know, I see the doctor for one thing and he puts me on this drug, and that drug causes side effects, so I get another pill to take, and now I'm having this problem, and I just keep adding pills and pills. And they say they're frustrated with that because the main problem isn't being addressed. Pills often work for a time, but when we're using them chronically, if we don't address the underlying factor, if we've got high blood pressure, if we've got a weight problem, we're not exercising, we're not eating right, that blood pressure medication may control our blood pressure for a while. But you know what tends to happen several years down the road?
What's that?
That blood pressure medicine is not sufficient. And you need a second drug, or a stronger drug, or a combination drug. It's the same with diabetes. And it's the same story. When people walk in my office, they say, you know, when I first had this problem, you know, I watched my diet a little bit, things were okay. Then I was on this one pill. Then I was on 2 pills. Then, in the case of diabetes, I was on insulin. You see, and it's just this relentless progression to more and more drugs. At the same time, they're not changing their lifestyle. They're not addressing the root causes of the problem.
So you sit down with them there at the Lifestyle Center of America, and what you do is say, what are you taking? How did you start taking this? And you start to help them just untangle it all.
Exactly. And we don't just throw away all their medications, but as they start responding to lifestyle, we often have to decrease the medications. We get someone on a good lifestyle, exercise program, diet program, it's dangerous to keep them on all their high blood pressure medicines.
So, I mean, someone listening today, let's say they just listened to this program and then they said, okay, I'm going to start exercising, doing these other things. They need to be checking with their physician as well. I mean, that's almost like a medication.
They need to be keeping in touch, you're exactly right, with the person who prescribed those drugs, because if they get really excited about changing their lifestyle, you're exactly right. Their need for medications will often decrease dramatically. If they're not in touch with their physician, they're asking for trouble.
A lot of people will go to these emergent care centers. They'll go to these immediate care places. They're traveling across the country. Maybe they're a business person. Maybe they're on vacation. Is there any danger with going to these places in terms of medication?
Well, the message I try to give people is when it comes to diagnosis, see an expert. Whether you're on vacation and you've got to go into one of these in and out doctor's offices, listen, if you need a diagnosis, you see a physician. Don't try to diagnose yourself, because that's asking for trouble. I mean, I see patients, they come in all the time and they're taking something, because they've got indigestion, and it could be a heart problem. So that's foolish to diagnose yourself. But once a diagnosis is made, then you're in a position to evaluate and talk with a doctor. What if I don't take this antibiotic for my earache? And the doctor may say, well, it may go away by itself. Is there a risk to not taking the drug? Ask that question. It's a telling question when you ask that question to a physician.
And I guess one of my concerns, just in closing off this segment, and I want to see if you agree with me, and that is, sometimes even though you get the diagnosis, and I agree with that, you need to get the diagnosis from a professional, your primary care physician, or the person that sees you most of the time, doesn't know what that person gave you. They're not in communication with one. They don't have your records, and that can be dangerous too, can't it?
No, you're right.
So we've been talking with Dr. David DeRose. We've been talking about medication. It's important to know what you're taking, why you're taking it, and more importantly than that even is to try and figure out why or how you can get away from taking it. We're not saying throw away your medications, but consult with someone who can truly help you. We're glad that you've joined us today.